Proof: Psychology in Film Case Presentation by Megan Morgan, Madison Ogle, and Darlene Rodriguez. Proof tells the story of a young woman, Catherine, who is dealing with the death of her father, an esteemed mathematician, who suffered from mental illness for several years. Catherine, like her father, was brilliant but did not finish her education because she spent her life caring for her father. One of her father's graduate students discovers a groundbreaking proof among her father's things and assumes that her father must have written it in his lucid moments. Catherine claims that it is hers, and he works to find who truly wrote the proof.
Throughout the movie, it is suggested that Catherine is suffering from the same mental illness that her father dealt with for so many years. She shows many signs of suffering from schizophrenia. Schizophrenia is a psychological disorder characterized by hallucinations, delusions, disorganized thought and speech, and social withdrawal. Individuals with this disorder may not be aware that they are behaving abnormally, and they may become aggressive if left untreated. Schizophrenia is categorized under the schizophrenia spectrum and other psychotic disorders in the DSM-5.
A strong indicator that Catherine suffers from schizophrenia is the fact that she frequently has hallucinations. In the opening scene of the movie, she believes that she is having a conversation with her father about mental illness and celebrating her birthday alone, only to realize later that the conversation could have never taken place because her father is dead. Catherine is also very paranoid. She constantly thinks about her father's graduate student is trying to steal her father's proofs. Another indicator of schizophrenia is her social withdrawal. Catherine goes through a period after her father's funeral where she doesn't speak or interact with others. She walks about in a very numb state for days on end. It is as though her emotions are switched off.
Catherine shows many symptoms of schizophrenia, but not necessarily all of the symptoms that can be associated with the disorder. One of the hallmark symptoms of schizophrenia that she is missing is disorganized speech. There are times throughout the movie when Catherine is withdrawn, but her speech is always clear.
A possible treatment for schizophrenia would be an atypical antipsychotic. This would reduce her hallucinations and help alleviate some of her negative symptoms, such as reduced speech and social withdrawal. Possible therapies would be a humanistic or positive therapy. This would allow her to really talk through her problems and form a better outlook about events in her life. It can help her make choices about upcoming events so that she doesn't just remain stagnant, living in her father's house. The treatment is ethical. We would just need to notify her of the possible side effects of the medication.
Movie spin. Schizophrenia is portrayed pretty accurately in Proof. The disorder is not always as obvious as one might assume. Catherine's case is a good example of this because although she has angry outbursts, paranoia, hallucinations, and social withdrawal, she has moments of clarity as well. She is still able to function for the most part. Also, schizophrenia is partially genetic, and this was portrayed through the fact that her father struggled with the disorder for years. It is a disorder that is often developed later in life, and Catherine doesn't really start to exhibit the classic symptoms of schizophrenia until her late 20s. The only thing that the movie over-dramatizes is Catherine's random angry outbursts. Generally, individuals with schizophrenia tend to be non-aggressive.